Okay, so we're back. We're going to talk about some complex lipids now. So we're going to do some structural stuff, nothing too crazy. And we're going to talk about kind of coming up to the edge of physiology where you're going to see different molecules with or having different physiological functions. So we're going to do some phospholipids, glycolipids, and things like that. So first we're going to talk about phospholipids, and we're going to use a triacylglycerol, a triglyceride, as our basis. And what I mean by that is we'll review that molecule, you know what it looks like, and then we'll say, well, we switch this for this and this for this, and that turns it into a glycerophospholipid or whatever phospholipid. Then down the road, you're going to see these molecules in cell membranes. And we'll do that. We're going to do another separate little short video on cell membranes because it's really cool the way the molecules line up and have the function they have. Intracellular messengers, we're going to hit those in endocrinology. Anchor some proteins in cell membranes, we'll get into that a little bit too. We're going to talk about phospholipids acting as surfactants in the lungs. Surfactants are really interesting molecules. They're kind of really soaps. They have a hydrophilic end and a hydrophobic end. One molecule wants to be in the water, or one end of the molecule wants to be in the water. The other end wants to be as far away from the water as it can possibly get. So that ends up making it align a certain way. Bile uses this kind of structural, function following structure, breaking up our fat droplets like we talked about, or will talk about, we haven't gotten there yet, we'll talk about in digestion of lipids. So we have two classes, and we're going to draw them. One is glycerophospholipids or phosphoglycerides. So as soon as I say gly, you're thinking carbohydrate. And awfully similar to a triglyceride in the fact that we have that glycerol backbone. But we're going to make phosphatidic acid instead, which is a diacylglycerol with a phosphate on carbon 3. It's kind of the molecule, or starts out as the molecule, that I'll be kind of hammering you next try about, don't forget that phosphate when you're trying to make the triglyceride. Really, really easy to forget it and end up with a glycerophospholipid instead of a triglyceride when you're trying to make it. So I'll remind you of our conversation now, next try when we're doing that. Then we're going to make sphingophospholipids or sphingomyelin. So the backbone this time is sphingosine, an amino alcohol that we'll draw out. It's an 18-carbon big molecule. And it's the backbone rather than glycerol, but we're going to tell the story in a very similar way in the sense of what are we attaching to that backbone. So everything we say is in the PowerPoint, like I often do, but it's just so much easier to draw it than to try to follow the PowerPoint slides, I think. So anyway, we're going to draw them, go through them, and talk about how we get to where we're going. Then I'll point out the PowerPoint slides that talk about the molecules that we'll have made or gotten to or talked about the structures of. So before we do that, let's talk about our triglyceride for a minute, and let me just remind you of something with it. So remember our triglyceride or our triacylglycerol, we said we have 3 carbons that came from glycerol. So we had 3 hydroxyls on here when it was initially an alcohol, but 3 fatty acids on those 3 carbons now are what make it a triacylglycerol or a triglyceride. So this is the molecule that kind of is our reference point with an awful lot of stuff. So what we're going to do is we're going to make glycerophospholipids. So we're going to have the same backbone. So we're going to start out with, or we're going to have the 3 carbons, and we're going to have fatty acids attached to carbon 1 and carbon 2 using most of the time an ester bond. So this gets a lot more relevant next try when we're actually making this molecule, but you got to start somewhere. So we're starting somewhere. This fatty acid is going to be an unsaturated 18 to 20 carbon fatty acid most of the time. What's going to be different than our triglyceride over here is we're going to have a phosphate attached to carbon 3, then something called a head group. So we're going to have a head group. So when we look at this molecule, if we take this much of the molecule, like just kind of forgetting the head group, that's actually called phosphatidic acid. And it came from a diacylglycerol. It came from 2 fatty acids bound to a glycerol. So what this head group is going to make a difference in terms of what molecule this becomes. So if the head group is choline, if it's ethanolamine, or serine, as a nitrogen containing molecules, that's going to take us one direction. If it's inositol or inositol 4,5-bisphosphate as a non-nitrogen containing, that's going to take us a different direction. So we classify first, or our first classification of the glycerophospholipids is based on the head group, but whether it's nitrogen containing or not nitrogen containing. So we're going to go to not nitrogen containing first because it's kind of quicker. So our non-nitrogen containing will give us things like phosphatidylinositol, phosphatidylinositol 4,5-bisphosphate. Can't talk and spell at the same time. Give us things like cardiolipin. Some molecules that you're going to see as you progress through physiology, things like that. Or we can have our nitrogen containing, and we're going to divide those again. So in our nitrogen containing, first we're going to stick with this ester bond. Remember, we said it's an ester bond most of the time. So if it's an ester bond, then we can get 2 different things. Phosphatidylcholine aka lecithin, or phosphatidylethynolamine. Aka cephalon. Oops. Sorry, won't let me write that close to the bottom. The thing that looks like a second parenthesis is supposed to be a C. A little rough, but a little bit better, I guess. Or we said that we can switch that ester bond out for an ether bond. So remember, we get rid of the carbon double bonded to the oxygen. It's just an oxygen bridging two parts of the molecule. So we switch this ester out for an ether bond. Then we can get a couple different things. If choline can beat the head group, and we can get plasma activating factor. We'll talk about that in a minute. If ethanolamine platelet activating factor. I was a step ahead of myself here. Ethanolamine is going to give us a plasmalogen. Talking and writing at the same time is challenging me. So depending again on what the head group is. So we're going to talk about those in the next couple slides, the characteristics of those different molecules. But that's the structure of the molecule. So again, we're doing kind of the compare and the contrast to our triglyceride, as in we're starting with the glycerol backbone. We've got two fatty acids, but it's down here that things get different. All right, so next, let's talk about sphingolipids. Sphingolipids are going to be a little bit different, but we're going to do the kind of compare and contrast idea again. Always easier to build a story than start a new story. So rather than having our glycerol as the backbone, we're going to have sphingosine. So we're going to line it up, well, kind of the way we need it lined up. We're going to have 3 carbons that we're going to work with, and they're part of the sphingosine molecule. Got a hydroxyl attached to one, got a double bond in part of the chain. Then we have 12 carbons, all with hydrogens on them. Then a methyl group on the end. And we can show our other hydrogens where they attach and everything. So we still have the 3 carbons that we're kind of focusing our story on a little bit. But we have some differences. We're going to have an amino group here. We're going to have a hydroxyl group here. So that's in the PowerPoint. It was a little difficult to put in words, but anyway, I tried. So we still have the 3 carbons. We have sphingol plus the fatty acid is really what we're trying to make here. And that's going to make our ceramide. So let's talk about what we're going to get from this. So we can have different things attached now to the next part of it. So we can have a polar group, and then we're going to look at what that polar group contains. So start with this part. This is the molecule we're starting with that we're going to start attaching other things to. So let's say we have a polar group. It's a good color for a polar group. Let's say first we have a polar group attached to the hydroxyl. So if we have a polar group attached, we can go a couple of different directions with it depending on what that polar group is. So first, let's say we have a phosphorus in that polar group. So we'll go the phosphorus containing polar group direction first. So if we have phosphorus in there. That's how we're going to get a phospho. And this is where it gets pretty important to break words down. The word looks horrible because it's so big, and then you break it down and it's like, not that big a deal. Phosphosphingolipid. And there's no spaces in there. I left a little bit of a space just so we could see where we're going with it. The biggest example of that you're going to see is sphingomyelin. We're going to talk about that a little bit. You'll talk about it a lot in anatomy. If the group is phosphorus bound to a choline or phosphorus bound to an ethanolamine, that's going to be your sphingomyelin. Or, let's say, I guess we'll stay with our polar group color. Let's say our polar group is a carbohydrate-containing polar group. So if a carbohydrate is part of it, this is going to be a glycosphingolipid. And again, with these words, break them down. It'll tell you what they're made up of. We can divide the glycosphingolipids into some different categories. I'm not sure it's super important at this point to do it, but we can do it. If the group's a single sugar, we could have a sirabricide, 2 or more sugars, globicide. If we have certain amino acids attached, we can get the gangliosides, things like that. So you're going to see these in anatomy, things like that. So we'll write them so you can refer back to it. We're not really going to get into it that deeply in the PowerPoint. Okay, so let's keep going then. So like we said, with the glycerophospholipid structure, still starting with glycerol backbone, so we're really leaving our phosphatidic acid alone, kind of, meaning that the phosphatidic acid structure is the glycerol backbone with 2 fatty acids on it and a phosphate. Then we add the head group to that. Depending on what that head group is, we go from there on what our structures are. Phosphoglycerides, another word for these, they're a major component in biological membranes. So we're going to see them a lot here and there. Like we said, glycerol 3-phosphate is the molecule we're starting with. We're putting fatty acids on the carbon 1 and the carbon 2. Typically on carbon 2, it's an unsaturated 18 to 20 carbon fatty acid. Then the phosphate on carbon 3 is coupled with another group. We call that the head group, and depending on what the head group is, determines what we're getting. Probably a better drawing than I drew. Where these molecules, or one of the places these molecules get pretty important, is in the context of surfactants. The molecule can align itself so the hydrophilic part, the water-loving parts in water or in an aqueous environment, the hydrophobic part, or the water-hating part, is in a non-aqueous environment. That's the definition of a surfactant. So a couple of the ones that we mentioned act as a surfactant in the lung. Because of the structure, and we'll talk about this with cell membranes, because of the structure, we can pack these molecules in pretty tightly. In the lungs, we're pointing the heads towards the alveolar cells, nonpolar towards the inhaled air. This prevents the cells in the lungs from collapsing on exhalation. So the molecule sits there and keeps the membrane structure a little bit. In premature infants, they don't have enough surfactant. So because of that, they need ventilation therapy. Okay, plasmalogens. We talked about them a little bit another glycerophospholipid, and this time we're replacing the ester bond with an ether bond at carbon 1, so ether rather than ester. Present in nerve tissue, the heart muscle, things like that. One of the ones we talked about is a platelet activating factor. And again, we talked about the structural difference. But this molecule binds to surface receptors, triggering thrombotic events, inflammatory responses, things like that, causing platelets to aggregate and degranulate. So platelet activating factor, an ether, not an ester, glycerophospholipid, a little more water soluble, allowing it to function as a messenger. So we'll talk about that in endocrinology. Stimulates, as the name would imply, platelet aggravation, releases serotonin, vasoconstrictor. We're going to talk about in endocrinology from the platelets. Big player in an inflammatory response, allergic response, shock, things like that. Okay, then we went to sphingomyelin. You're going to see sphingomyelin in anatomy. So we've got a long chain fatty acid attached to the amino group of sphingosine. Remember, sphingosine replaced the glycerol when we're comparing one structure to the other. So through the amide linkage, producing a ceramide. That's going to act as a precursor to your glycolipids. Sphingomyelin, the alcohol group of C1 on the sphingosine, is esterified, and that changes our structure as well. Really big deal with the myelin coating on our nerve fibers. You'll talk about that. Also kind of interesting, it's the only significant sphingophospholipid in humans. So major component of membranes, brain tissue, nervous tissue. Don't forget, we're not using glycerol as our base, although we were using it kind of as our comparison. But we're using sphingosine instead. So glycosphingolipids are abundant in nerve endings. You'll see that in anatomy, some physiology and everything. They're a receptor site for acetylcholine. We may get to that, but you'll definitely get to it in physiology. Electron micrograph of a myelinated fiber. Okay, next place we're going to go is eicosanoids. Eicosanoids are kind of baby hormones in a way. So again, we're going to go through the structure of how we get them. So the prostaglandins, the thromboxanes, the leukotrienes, they're collectively called the eicosanoids. Come from polyunsaturated fatty acids with 20 carbons. We'll talk about that. And we get a pretty wide range of physiologic and pathologic responses from these molecules. So they're different than hormones. That's why I kind of call them baby hormones. They're made in very small amounts everywhere. When we get into hormones more, or a little bit we have gotten into them, you probably noticed we're talking about we're making it here, we're sending it there, kind of thing. And that's a story you hear with hormones. We make it here, we store it there, we use it somewhere else, kind of thing. We make these guys in really small amounts in almost all tissues. They act where they are made. We're not making them someplace and sending them someplace. They do what they're going to do, and we get rid of them. So again, a little different. We're not storing them somewhere. We're going to use them. When we're done, don't need them anymore, we get rid of them. We'll talk about the G proteins a little bit later. So eicosanoids, like we said, are derived from polyunsaturated fatty acids. We're going to go through that derivation and talk about the molecules that we get. Okay, so let's just go ahead and do it. So what we're going to do is we're going to start out with a molecule of arachidonic acid. So where we get arachidonic acid is from the cell membrane. So that gets pretty important. So we have the cell membrane, and an enzyme called phospholipase A2 makes the cell membrane release arachidonic acid. Phospholipase A2. And we're going to get arachidonic acid. And that arachidonic acid can go a few different directions. So, one thing it can do is it can get recycled. It can get recycled and go back into the cell membrane. So that's one option. Another option is it can go into a lipooxygenase pathway. Or a LOX pathway, VLOX pathway, I should be saying. So that's one option. The other option is it can go into a cyclooxygenase pathway. Or COX pathway. So we have three options. It can recycle back into the cell membrane, go into the LOX pathway or the COX pathway. Let's do the LOX first because it's a little quicker. So we have one enzyme doing the job twice, making two different molecules on this, resulting in the formation of leukotrienes. The enzyme itself probably isn't something you really need to worry about remembering, just that we're getting to the leukotrienes. So the enzyme that's going to do the job is 5-lipooxygenase. That's going to make us a molecule called hydroperoxyicosanoic tetranoic acid. So we'll just abbreviate it. Make my arrow a little bit longer. Then 5-lipooxygenase is going to act again. Going to act again and give us leukotriene A4. And we'll talk about these in a minute. I just want to it's easier to draw where we're getting them than do it in words in the PowerPoint. Leukotriene A4 that will give us the rest of the leukotrienes. Leukotrienes are a major inflammatory molecule. So they get pretty important in any story related to inflammation. Okay, so the other option is we can go on the cyclooxygenase pathway. What that's going to do is use COX-1 and COX-2, cyclooxygenase 1, cyclooxygenase 2, we're going to talk about those in a minute, and make a couple different things. Going to make molecules called cycloendoperoxides, so PGG2 and PGH2. But what I would know about them is that they're the cyclic endoperoxides. So we've got those, and they're actually going to go to three different molecules. We're going to make, if we use prostaglandin synthase, we're going to make prostaglandins. If we use prostacyclin synthase, we'll make prostacyclins. We'll talk about all of these in a few minutes. And if we use thromboxane synthase, we'll make thromboxanes. Okay, so where we're really going with this, and again, it's in the PowerPoint, so I'm not going to skip over anything in the PowerPoint. I don't know, I think it's easier to tell a story in a picture. So we'll tell a story on a picture. So we can have COX-1 and COX-2 inhibitors. So we're going to back up to what COX-1 and COX-2 do. They make all of these molecules that are pro-inflammatory molecules. But COX-1 does something else also. COX-1 maintains the epithelium in the GI tract. So it has some pretty important functions, but that's one of them. So we have medications, and you're going to get into it all in pharmacology with, I think Dr. Rubatsky's teaching it, but you're going to get into all of that, and you're going to talk about what you inhibit. So let's say I want to inhibit an inflammatory response. We can have COX-1 and COX-2 inhibitors. So that's the older NSAIDs like aspirin, ibuprofen, things like that. So what I'm going to do there is I'll inhibit these guys, and I'll prevent the formation of the prostaglandins, prostacyclins, and the thromboxanes. Some of the newer drugs that were on the market for a while would only inhibit COX-2, and he's going to spend some time talking about that. So you have the COX-1 maintaining the GI epithelium and everything, but these are drugs like Celebrex, Vioxx, things like that, that have been taken off the market since then because of a lot of cardiovascular issues he'll talk about. Notice with those, though, with all of the medications that we've talked about, we're on the COX side of the story. None of those were on the LOX side. None of those are preventing the formation of the leukotrienes. So that's a little bit different story there. One more medication that he's going to talk about too is some of the corticosteroids, cortisol. If we want to eliminate the formation of the leukotriene, we could use those because they're going to focus on the phospholipase A2. So when you get into that conversation in toxicology and pharmacology and everything, and again, really pay attention in pharmacology, it's easy to put a block up and say, well, I'm a chiropractor, I'm not going to prescribe, therefore, I don't need to worry about this. You're correct, you're going to be a chiropractor. It's a very good possibility you're not going to prescribe, but again, your patients are going to have been prescribed too. So you're going to get those chemically altered patients. You need to know what's going on with them. So hold your thought on this with the COX and LOX pathway for when Dr. Rubatsky is talking about COX-1, COX-2 inhibitors and inhibiting phospholipase A2. Okay, so really the story we just told with the icosanoids, starting out with arachidonic acid, and everything else comes from there. We're pulling the arachidonic acid out of the cell membrane. The icosanoids, again, aren't active for very long, and they're very, very local. Some of the effects, a lot of things we're going to talk about, a lot of things you're going to talk about in pathology, physiology, things like that. Gluconeogenesis, glycogenolysis, lipolysis or lipolysis, breaking down lipids, that's all our department. Heart rate, that's going to be physiology. Icosanoids aggregate platelets. They can inhibit aggregation. Physiology again. Change neuronal Okay, sorry about that. I thought I'd get through this before the blonde guy and the dog had their little thing. So anyway, platelet aggregation inhibition and everything is something you'll talk about. The electrical activity in the neurons you'll talk about. Muscle contraction, we're going to play a role there. Blood pressure, vasodilation, vasoconstriction as part of the inflammatory response. When in excess, and that's something that gets very big in the inflammatory story, that's when we get pain, inflammation, fever, nausea, vomiting, things like that. Okay, the nomenclature. First two letters are what kind of icosanoid it is. Third letter talks about what the substituent group is attached to the ring or side chain. Finally, the number of double bonds is the number. So leukotrienes spell inflammation. We're doing the LOX pathway, starting with arachidonic acid, making the leukotrienes. So this is our inflammatory response, super sensitive, much more potent than a histamine. We can have bronchoconstriction, smooth muscle contraction, I can't talk today, chemotactic properties, allergic reactions, inflammation, things like that. Increased permeability of the capillaries, edema. If it goes too far, it can go into anaphylactic shock. Prostanoids, these are our prostaglandins and our thromboxanes. These are the molecules we're getting going the other direction. COX pathway, still starting with arachidonic acid, just going down the other side of the diagram we drew. So a dietary precursor is linoleic acid. That's going to go to arachidonic acid, go through the rest of our story. Like we mentioned, we have our phospholipase A2 starting out the story, then continue through our diagram. So we talked about our isozymes a little bit, COX-1 and COX-2. COX-1 we're making in most tissues, but it has the function of keeping your gastric tissues healthy, keeping your kidneys in homeostasis, platelet aggregation, things like that. COX-2 can be induced in a few tissues, but it's very much about an immune response and an inflammatory response. So, COX-1 is expressed at low levels in a lot of different cell types, but the big deal with it is it's important in maintaining our GI endothelium. COX-2 is stimulated by cytokines, endotoxins. It's all about inflammation. So, like we mentioned, we've got a couple of different medications. You're going to learn a lot more about them in pharmacology and toxicology. But cortisol inhibits right at the beginning of that diagram. Cortisol, so the corticosteroids, will stop both COX and the LOX pathways, so stop us from making all of the molecules we talked about. The NSAIDs, they're going to inhibit COX-1 and COX-2. Aspirin is going to get both, and as a result can damage the stomach, damage the kidneys, things like that. Those are our older ibuprofens, aspirin. Some of those medications also impairs blood clotting. Some people will use that on purpose as a blood thinner. Decide where you are on that. A patient might ask you, I read I should take a baby aspirin every day because I'm older. What do you think, doc? Go do some research on that, see what you think about that. COX-2 is COX-2 inhibitors, like we said, are meant to leave COX-1 alone, but still stop the inflammatory pathway. Problem is that those medications, Celebrex, Vioxx, things like that, their use was associated with an increased risk of heart attack. I'm saying was because I think they're off the market now. Okay, so the pathway we talked about, again, diagrams drawn a little bit better than I did. And our pathway again, and that's it. Okay, so we'll stop there and move on to our next module, which we're going to have a couple of shorts in here. We're going to talk about the cell membrane and everything. Then we're going to move on to a little bit of an introduction to nutrition.